working. Our next speaker is Dr. Saif Alhayek, who's a dentist. And Dr. Hayek's going to talk to us about diabetes from a dentist perspective, manifestations, contemporary treatments and complications. So Dr. Saif is a dentist who is the principal of 4 private practices, founder of the Advanced Dental Implant Institute, and is a clinical tutor at Sydney University. And look forward to hearing his presentation, because I've certainly seen a number of patients over the years where their glycemic control has been difficult to treat until we've sorted out their dental issues, in particularly periodontitis. So look forward to hearing you talk, Saif. Thanks.
Thank you. Well, good morning, esteemed colleagues. Thank you very much for coming here. It's absolute pleasure and an honor to be presenting in front of a bunch of very talented and amazing health professionals like yourselves. I mainly today will be discussing the dental implications and the concerns for us as dentists when we see diabetic patients, and the latest or the modern dental procedures and technologies in treating those patients after controlling their conditions. So I'll skip through very quickly in the interest of time the etiology and the presentation and the symptoms and management, the medical management of diabetes, because I believe the previous presenters already done a wonderful job discussing that, and I'm sure you're all no strangers to diabetes and the management of that. So as you know, diabetes mellitus, type 1 and type 2, we have already spoke about the clinical, the genetics, the pathogenesis, and the islet cells. Other etiologies and drugs, drug or chemical usage and infections and endocrinopathies. As you know, the classical symptoms are the polyuria, the polydipsia, the polyphagia, weight loss, delayed wound healing, and weakness. Diabetes affects the entire body, all the organs, central nervous system, the eyes, the smell of acetone in the breath, the systemic and the weight loss, the respiratory, gastric and urinary, and the liver. It affects all those organs and all the major organs, but there's very little attention given to the oral complications, and there is a very strong relationship between a person's oral health and their general health. In people with diabetes, first signs and symptoms usually of medical conditions are developing in the mouth. The oral manifestations include xerostomia, which is drying of the mouth, burning sensation, overgrowth of the gum tissue and the periodontitis, tooth decay, periodontal disease, fungal infections, the fruity breath that our patients usually complain about, or the acetone breath, and the increased thickness of saliva and the altered taste sensation. This is the typical presentation of xerostomia, and we deal with this on a daily basis in the dental practice. See diabetic patients literally every single day, and we need to be able to manage those symptoms and control and liaise with other medical practitioners to control their condition. And that's the overgrowth of gum tissue, the teeth decay that we deal with, the oral fungal infections, and then the periodontitis or the periodontal disease, and that eventually leads to a recession, loosening of teeth, and then loss of teeth. To manage those, we always assess the glycemic control. We liaise with other practitioners or refer to the physician. We use a glucometer to check there and avert emergencies. And we always schedule patients for a shorter period, or shorter treatments, and early morning usually. The objective is to maintain the blood glucose level as close as normal as possible. And for us, in dentistry, the dental considerations are to minimize the risk of intraoperative emergencies by taking appropriate medical history. As I said, giving them morning visits, shorter visits, doesn't coincide with big physical activity. Make sure that the patient has, if they're on insulin, they've taken they had their breakfast and they've had something to eat. And a lot of times we give prophylactic antibiotics to if there's an established infection or as a pre-operation contamination or major surgery. One of the most serious consideration for us in the dental practice is the hypoglycemic emergency or the insulin shock, and basically it, as you know, it's a life-threatening condition or situation, and it occurs when the blood glucose drops. The features are confusion, sweating, tremors, agitation, anxiety, dizziness, tingling or numbness, and tachycardia. And sometimes it leads to seizures and loss of consciousness or convulsion and coma. The appointments should be of short duration, source of glucose such as orange juice or lolly or anything like that to be available, prophylactic antibiotics to patients taking high doses of insulin to prevent postoperative infections, and also to always check the blood sugar levels, that they are within normal, and make sure that we minimizing any emotional stress, and that's by achieving appropriate anesthesia and have a very relaxing atmosphere. And I know it's a bit hard when you come to the dentist. As soon as the signs and symptoms are presented, we should check, when that we're talking about the hypoglycemia, we should check for blood glucose, establish adequate airway, breathing, circulation, and have a carbohydrate of some sort, a fruity juice or or sugar or lolly. If they are unconscious, as the previous presenters have discussed, we can give intramuscularly or even intravenously to try to stabilize and normalize the situation. Diabetic patients should be motivated to maintain good oral hygiene, brushing twice a day, flossing, keep their dentures clean, because that's where usually we get the fungal infections. It's that combination of the dentures and the diabetes. Regular examination, prophylactic measures such as topical fluoride to prevent decay. They should be informed that diabetic patients are more likely to catch dental disease than other patients, and they need to be aware and educated about the preventative measures that we should implement. Cavities should be treated as quickly as possible. Mouth dryness should be treated with salivary substitutes, or ask them to suck on sugar-free lollies or chewing gums. Good oral hygiene, good oral health, maintain glycemic control. Contact the dentist if they notice bad taste or white patches or swollen or tender gums, and encouraging to stop the smoking, as it's very detrimental as well. Once we have their diabetic condition under control, and for a period of time where we are satisfied that they are that their blood glucose level is controlled, it's not having or minimal side effects that it's having on their health and their oral condition, then we can progress to more definitive, more permanent treatments and dental treatments. And they're basically from implants to restore missing teeth, to fillings and crowns and bridges, and in more recent times now we can treat gum recession, which happens after the treatment or the control of periodontitis, when people have their gums receded, which was very irreversible and untreatable. And nowadays with latest techniques and technologies, we can even treat that, and of course the regular hygiene visits. So if I want to introduce here, we've got Madeline. She is 59, and that's basically a technique we call all-on-4, basically placing 4 implants to restore edentulous patients, or patients without teeth. I was lucky and honored to have my training by Dr. Paulo Malo in Portugal 11 years ago, and that was a shift in the way we treat for dental implants. We used to, for edentulous patients, we used to do bigger surgeries, sinus lift, bone grafting, and that's for diabetic patients. It can add to the morbidity and the possible complications. Nowadays we're trying to limit that, and we use guided surgeries and CBCT, which is the dental CT scans basically. So in her case, you can see that's the before and the after. Aesthetically, facially, also in terms of the self-confidence for those patients, and of course the health of and the ability to eat better diet and look after themselves. It definitely improves when they have good oral health and teeth to eat on. And that's basically the all-on-4 in her case. She's type 2 diabetic as well, but after 12 months of monitoring and maintaining that she has good control for her diabetes, we were able to give her teeth back and restore her smile, and also restore the vertical height of her jaws and the way she looks. And obviously you can see that she looks much younger.
5 minutes.
Yeah. This lady, Kim, you can see that she had multiple missing teeth, the typical dry mouth, and that leads to decay. And again, with the help of the CBCT, in her case, she had softer bone or more porous bone, and therefore we placed 6 implants, or what we call the all-on-6 upper and lower. And that obviously you can see it restores their oral health and their appearance and their confidence. The gentleman, that's the all-on-6 prosthesis. Once we removed all the dentally compromised and pre-dentally compromised teeth, we established control of his diabetes, and then we were able to do guided surgery to place the 6 implants and have all his teeth restored. And the good thing is, dry mouth doesn't really affect implants or prostheses as it affects teeth, because they're not going to have decay. But it's important that we keep the hygiene, keep the cleaning and the cleansability of those prostheses, so we have long-term effect. And that's basically his before and after for his upper teeth. The new techniques in terms of surgeries or gum surgeries, we used to take gum graft from the palate and then tunnel it or suture it to the teeth to treat the recession. Nowadays, with pinhole techniques, we can restore and treat the recession with literally small holes, or what we call pinholes. And I had the pleasure to be trained by Professor Chow in California. And that's a video we can show later on. It's just for the interest of time, probably I'll skip that. With the pinhole gum recession regeneration technique, now we make a little hole, as you can see there, and through that little pinhole we can access the gum. We loosen the gum. We then insert collagen in there, and that will maintain the structure of the gum. And you can see the effects when in treating the recession, and the predictability and the reduced morbidity and reduced complications, especially for diabetic patients. Another case where you can see the recession there, and we were able to treat that with the pinhole, very painless and with minimal or less invasive surgery. Again, this patient She has recession on both sides. I've decided we're going to do one side first to see the effect of that, and you can see the effect of the pinhole gum surgery on the left side in front of you. You can see that's a week on the day of the surgery, a week later, and then a month later. And you can see then we've done her right side, but I think it's interesting to see the
1
effect
minute.
on both sides. Thank you. Then we've got the full mouth rehabilitation. Once we control the diabetes and have optimum periodontal health and make sure that we have good control of their periodontal disease, then we can progress into doing diagnostic models and diagnostic wax-ups, and then we can then restore their teeth, transform them into a better bite, better occlusion, better health of their gum. You can see before the control of his diabetes, the gum disease in there and the wear on his teeth, and that's basically after the full mouth rehabilitation, where we restored the teeth, more aesthetic look, and a better control of his gum condition. And finally, Julie, also diabetic, after we controlled her diabetes and maintain appropriate periodontal health. That's basically her before and after, and you can see the teeth that were badly damaged and heavily filled after her full mouth rehabilitation, and the occlusal analysis and achieving the results that she desired. Well, thank you very much, everyone, and don't forget to floss.
Thank you very much, Dr. Saif. Thank you.